Okay, so I am calling the meeting to order, and I'm letting people know that as a result of our retreat, we did come up with a new introduction to the meeting, which this will be the first time that we're reading it publicly. And I'm going to read the first part, and then Bob Cobb is going to read part of it. You have it, Bob?
Yes, I've got it up.
Okay, and then I'll read the final part. So, the Mental Health Board, who we are. The Sonoma County Mental Health Board is an advisory board empowered to listen to the concerns of our constituents and to help formulate policies that offer a consistent continuum of care for all those with mental health challenges. We are further empowered to advise the County Board of Supervisors on the mental health system of care. Bob?
Yes, we support reducing stigma for individuals needing all levels of mental health care in all communities in the county. Treating each person with compassion and respect, regardless of gender, sexual identity, and cultural or ethnic background, and acknowledging the influence of individual lived experiences. Working with the local mental health system to eliminate racism from our minds and hearts, and ensuring that our policies are equitable and benefit underrepresented communities. Acknowledging that environmental factors can increase mental distress and supporting efforts to reduce such stressors. Providing support to the families of those with mental health challenges.
The Sonoma County Mental Health Board collaborates with the Behavioral Health Division of the Sonoma County Department of Health Services to increase public and professional awareness of individuals with mental health challenges. We strive to influence positively the mental health system by listening to public input and working with behavioral health services to create policies that will offer hope to individuals living with mental illness and to their families. Okay, so let's go ahead and do the roll call. And if you can call out people's names, Tori, and I'll take note.
Sure will. Patricia Gray. Peterson Pierre. Betsy Chavez. Carol West. Marianne Swanson.
Here.
Vanessa Nava.
Here.
Michael Johnson. Annabelle Nygaard.
Here.
Bob Cobb.
Present.
Where are we at here? I lost track. Sorry. Peter McElweeny.
Was excused for the first part
Yes.
of the meeting, at least.
Excused. Bob Hales.
Here.
Kathy Smith.
Here.
And I believe that's everyone.
So that gives us 1, 2, 3, 4, 5, 6 people, which is not a quorum. So we'll wait and see if somebody else shows up before we look at the minutes to approve them. Consumers Affairs Report. Do we have a consumer who would like to report?
Michael from WCC. I'm going to let him speak.
Okay, and my computer's going to die, so I have to run get a plug. So I'll be right back.
Okay. Go ahead, Michael.
All right, good evening, everyone. It's Michael, Peer Programs Coordinator for West County Community Services. Just want to let you know that our peer centers have been open for 50% services. We're doing in-person services at the EC. There's an outdoor deck where there's been lots of activity. Folks are showing up as the shelters are starting to close. They're coming over and visiting. We're running the shuttle to the EC. Also have a garden projects that's beginning there. So we're learning to grow some food together, sharing that. PPRC down in Petaluma doing one-on-one peer support, as well as the warm line calls. Interlink is open for in-person groups and also one-to-one peer support that's happening. Remote and Zoom groups are continuing with the CSN board and care homes as well. Wellness continuing with all of their services that were going on prior, as well as doing in-person groups and the workforce training internships. MST, our peer outreach worker, has started doing one-to-one visits at the CSU. We're doing one-to-one peer support there. And also with the loosening of restrictions is now back in the detention center, able to do one-to-one peer support visits on site at the detention center. And whole person care peer outreach worker and the MST outreach worker are also continuing with the doing warm handoffs for those who are being released from the detention center, helping to connect them to resources, as well as doing one-to-one peer support. And I think that's all I have for this month, unless you have specific questions, I'm happy to answer.
Anybody have questions for Michael? Okay, thank you for your report.
Excellent. Thank you. Thanks for all your work.
Do we have public comments? Do you see anything, Tori?
No, I don't.
Okay. Okay, so we do have an appreciation, and the appreciation this month is for West County Community Services. And oh my goodness, I left that out there too. Do you have that certificate that I sent to you, Tori?
It's up. Hopefully you can see it.
Thank you. Yes, I can see it. And so, Christy, I'm going to have you accept this for them, but this is a certificate of appreciation for West County Community Services. The Sonoma County Mental Health Board is honoring your dedication to the mental health and well-being of the residents of the Russian River area and beyond. You have shown your dedication to supporting people in need by working with seniors who may be experiencing isolation. The shelter you run in Guerneville has provided a place to call their own for a time for those without homes, and you have helped house many of that population. You've given financial support to those at risk during the pandemic. Your counseling services have been available for a wide variety of clients. And most recently, you have taken over the peer-run centers for county behavioral health. Your work is appreciated. So this certificate of appreciation is awarded to West County Community Services. So I will be dropping that certificate off at the West County Community Services offices. So
Thank you very much. I've been with West County for 8.5 years, and we've had different staff, we've had different leadership, we've had to let go of loved programs, and we've added incredibly valuable programs. And from my experience, this is the best version of West County so far. And every individual that works for us works so hard to provide these services to the community. Excuse me, and we wouldn't be the same organization without each and every individual that we have with us. So thank you.
and I have I've lived out here in West County for quite a while, about 40 years, and I've watched your organization grow from something that was very sweet and innocent and small to something that is providing many, many services. And I'm sure that I left some of them out on the certificate, but there wasn't room to put everything. So your work is much appreciated. Okay, so with that, would you like to tell us more about what you do?
Sure, let me see about sharing my screen. It says it needs to be disabled for screen sharing.
Okay, it should work now. Try.
Thanks. Okay. All right. So West County Community Services, the organization has been around since 1975. We have gone through different iterations. We've absorbed another counseling agency in Santa Rosa and became Community and Family Service Agency. That's when I was hired. And then we had to let go of it and we came back to our roots from we moved to Sebastopol for that. And then we came back to Guerneville and became West County again. We have a housing department, a focus on our 3 departments. Our housing department, Danielle Danforth is our director, and we offer rapid rehousing, case management at Mill Street, Fife Creek, Petaluma Avenues, and we also run our emergency winter navigation center, which has shifted from a 3-month or a 4-month shelter to it's been a year, and we just learned this week that we'll be extending out another 3 months, so through September. Park Village, where we manage the property, all the tenants there had been on notice multiple times for eviction, and then when the city offered the management to us, we were able to ensure their stay at Park Village. And we've also added 10 living structures on site where we have housed individuals that were previously homeless, and multiple families. The winter shelter, well, it's a navigation center right now, but normally it's our winter shelter, which is regular in the winter. Crisis support services, right now we're offering financial support through COVID funding, and we're helping people pay their rent. Our senior services, we have a senior center that we own and operate in Guerneville. They have classes from the JC there, and they serve meals. They have pop-up restaurants, and through COVID, they've been serving brown paper bag lunches. They also have a case manager on site that helps people fill out SOS applications and submit those applications. We have the newest program for our senior services is our transportation department, or program, excuse me. And they will schedule drives into Santa Rosa, Sebastopol, Guerneville for shopping, for social activities, medical appointments. Yeah, this has been a really valuable new service for us to offer. Our employment service, we offer employment services for transitionally aged at-risk youth, and then also adults with disabilities, although periodically we get a little green light in the middle of the year to have available services to anybody in Guerneville that for walk-in services. And these services are helping people build resumes, like build by writing their resumes, practicing interviewing skills. We don't place people, but we have a lot of connections, and we help people find a good match for employment. Our counseling department, we have, I'm sorry, I missed. For our employment services in our senior center, the director is Emily Heinzelman. She's been with us for a long time, 13 years, I think. Counseling department, we have youth services at schools, at our local schools. We have a school counselor and a therapist placed at Guerneville Elementary. And throughout the pandemic, they were offering telehealth through Zoom, phone calls. They were calling and checking on parents. They offered like a recess, like a coordinated recess time for kids on Zoom. And we also partnered with SCO this year, and SCO trained our therapists to provide trauma-focused CBT. And so they would send us referrals through the school year for kids that scored high on their measurement tool. We also have family liaison counselor that we've had placed at Guerneville and Monterey. And she just meets with families, that have been identified as high risk or in need of services to help them be able to make it to school. And so she meets with them. She'll go get an individualized food box from the food bank to help them out in the moment. She will buy clothes for kids if they don't have jackets or shoes. And then she works with the parents to identify what their ongoing needs are, and then where are the resources for ongoing support for those in our community. And right now we're gearing up. So school's out, so these programs are on hold for the summer. And so right now we're gearing up for our summer adventures with kids, which has been running for 31 years. And so we have, it's an abbreviated version. Normally they run from mid-June through the first week of August, and they have 2 activities a week. This summer, we're going to provide 5 activities once a week through the month of July. And they go to Morton Warm Springs. They traditionally go to the fair in Santa Rosa, and they have an overnight stay in San Francisco at the hostel down on the wharf. They go camping at Point Reyes and horseback riding. And so the point of this activity is, or this program is, to really help kids be able to go and experience things outside that they wouldn't normally be able to, whether their families are working or they don't have the funds. It's a fully funded program. There's a request for a donation of $20 for the whole summer, and they can pick the activities they want to go on. And that $20 just helps kind of put in for buying food at the food bank to take for snacks and PB&Js and stuff. But we will not turn a kid or a family away for not being able to pay that. So we are still accepting applications for that for this summer. And then we also are providing a specific one to the kids at Park Village. For our kind of general community members in Guerneville, we have crisis support services. It's only 4 hours a week, but this counselor does similar services as a family liaison. They work with people to identify what their immediate needs are and then their ongoing needs. And she will go find it to help them get something for in the moment, whether it's a gift card at Safeway or a food box from the bank, clothes for their kids. And then she helps them figure out where are the sustainable sources for these things and help them meet their needs in the longer term. She also helps people fill out SOS applications for one-time financial assistance. We have a human trafficking outreach worker. We're working our subcontract with Verity. And so we really just identify people, and our whole person care outreach worker is really helpful in this. They communicate a lot to identify people that are at risk or potentially we suspect being a victim. And then we work with Verity to refer to appropriate services. Our peer programs, which Michael Reynolds reported on earlier. we have a peer support, a peer outreach worker on the mobile support team. And he works a lot with individuals that are coming out of CSU and the detention facility in Santa Rosa. We have our whole person care team. We have a peer outreach worker in Santa Rosa and one in Guerneville. And they're hardworking out in the streets, in the bush all the time, meeting with individuals and helping them kind of get the foundational services that they need so that when they are meeting with their case manager and other services with the county, that they're better equipped for that and hopefully transitioning into housing. Peer education and training with Kate, who normally presents in here. And then the peer centers that we have, the Russian River Empowerment Center in Monterey, Wellness and Advocacy Center, Interlink Self-Help, and Petaluma Peer Recovery. And I'm just going to highlight the EC right now, just because it's the work that's on the river, and that's kind of the focus that I was having for this. Through the COVID restrictions and shutdown, Michael Martin, our program manager, has done an amazing job of modifying our services, getting them online as quickly as possible, what we could get online, and provide immediate support through Facebook engagements and then eventually through Zoom. But he also, from the start, found ways to get out into the community. Since we couldn't have our community come to us, go to them. And so he started providing, and he's still providing services at the navigation site, the Vets Hall. On Fridays, he runs an art class there. Our shuttle just started running again and bringing people out to the Empowerment Center, and they are super busy. He also, excuse me, went to the Redwood Alliance to run a group out there for their homeless population that they were housing out there for like peer support. He did an art class, so he was really helpful out there. Trying to think. Right now, like I said, they're busy. People are coming. We have a lot of new people and a lot of old people returning. They're starting to garden and doing outdoor activities. We have counseling for older adults, and this is services through the County of Sonoma. We have 2 senior programs, a senior peer counseling, where we offered up to 12 in-home meetings. Through COVID, it was by phone or by Zoom. We have 4 groups running in Sebastopol, Santa Rosa, and Roanoke Park that are by Zoom, and 3 of them are returning in person by the end of July. And then we'll keep 1 by Zoom to reach the people that can't leave their home. The counselors in this peer program are not clinicians. They come from a wide variety of backgrounds, and when they sign up for a 3-month training with our program managers, and then they have bi-monthly supervision and group for continued support. Our senior therapy program, we offer up to 10 in-home sessions for anybody in Sonoma County that's with an associate MFT or licensed MFT. And that also has been offered through Zoom or by phone. And we're looking at probably July being able to offer in person again. And that I just ran through, I feel like, very quickly. So that's our counseling department. Are there any questions?
I have a question.
Yep.
You mentioned the Redwood Alliance and what Michael had been doing with the peer group there, art therapy, and so on. I'm wondering that, I don't know if it's entirely the same population, but I know that a certain amount of the folks who were at the Redwood Alliance are no longer there, have been moved to Windsor. And that's ostensibly a senior population or folks with some form of medical issues. Has that population been followed by anyone from West County Services?
No, well, there were a handful of those individuals that were potential whole person care clients, and our peer outreach worker was meeting with them. But we didn't provide any services at Redwood Alliance other than this peer service. And so we weren't able to track anybody.
Has Redwood Alliance completely closed that site? I guess it was near Forestville, is that right?
Yeah, it was in was that like near Camp Meeker. Their plan was to start exiting people at the start of June and to be closed by the 30th. And I don't know if everybody's gone yet or not.
Thank you.
Mhm.
Christy, you mentioned this before, but are some of your peer counseling services which had to go to Zoom, are they going to continue? I mean, has there been any benefit of having Zoom as an additional outlet?
Yeah, in all of our programs, the Zoom, nothing takes the place of in person, yet the Zoom offerings really were able to reach people that couldn't leave or were unable to leave their homes. And so our peer programs are going to continue. We'll be running a new version of peer programs with a hybrid, where we'll have some Zoom offerings still weekly, hopefully a smart recovery group by Zoom, and our senior program. One of our groups will continue by Zoom while the other 3 will return to in person. Telehealth, that's always an option to be able to provide that. And then with the schools, I would assume that, well, we'll see what happens in the fall, but I would assume that all the kids will be back on campus full-time next fall.
Thank you.
Mhm.
Other questions for Christy? Okay, so I can't pronounce the name of the person from West County Health Centers who in the chat said that she would like to talk a little bit about the West County Health Centers. So if you could let her in, Tori. You can introduce
Yes.
yourself.
She's in.
Hi, this is Linnea. First name Linnea, last name Cyberlick Wheeler. Great to have to be here and to see you all. I want to give some updates on what West County Health Centers has been doing, and then I can also follow up on a couple of things that Christy was talking about and some of the questions that were brought up for her. I am a clinical social worker with West County Health Centers, and I'm the Associate Behavioral Health Director at the Russian River site in Guerneville, as well as the Program Manager for the Healthcare for the Homeless site at 3rd Street, also in Guerneville. Internally, we have had a really high wait list for behavioral health services this past year, most likely attributed to the pandemic. About 200 people at any given time were waiting for a therapist, even as we were seeing new people were being connected to therapists every week, several times a week, sometimes daily, and we still had that wait list stay up at about the 200s until this last month. We were able to get it down to about 60, partly due to hiring. We've onboarded, I think, 6 new additional clinicians to our team, including 2 child pediatric therapists and someone who specializes in geriatrics as well with dementia. And also, I think with the opening up of just our cities and county in general, people's mental health is starting to be addressed in other ways in addition to our services. So that feels really good. We've been focusing a lot on strengthening the integration of behavioral health in our physical health services, and have started some additional group visits, some pain management group visits that are facilitated by both a medical provider and a behavioral health provider, to integrate both the medical treatment of pain as well as the behavioral and emotional health and quality of life changes that can help support pain management, for example. So we're very excited about that. We've also been improving our internal structure to support consultation. Because we do a lot of work with a lot of people, and as coworkers, we like to talk to each other about what we're doing to help improve, and we've formalized that in a way. So 2 times a month, we have a designated hour where all medical providers, psychiatry, and behavioral health providers are included in a conversation where we do a case presentation. And so very excited to have that as a part of our routine now, and not just sort of getting a hold of people when we need to. I think that's improving all of our work. At the 3rd Street House, we have a shower now. It has been finished. The renovation was finished just in the last couple of weeks, and we're working to reopen our waiting room area where 2 patients at a time will be allowed to come into the waiting room area and begin to be able to start accessing that shower. The Redwood Gospel Mission will continue to come out once a week with their shower van to also support the physical health of our patients in this area in that way. Our teen clinic that is usually in Forestville, now during the pandemic moved to the Guerneville site due to some renovations that were needed at the Forestville site. And that has opened to in-person. So if teens in the West County area are needing behavioral health services, they can show up in person to that clinic again. We started a wellness website, which I can put in the chat so Tori could add it to the notes if that's helpful, to focus on tools for building resilience and support the overall wellness of our larger community, so that people can, in addition to having appointments and accessing our services in standard ways, can also have a way to practice things at home. And that includes like meditation, videos, tips for nutrition, and a variety of other educational materials. We're doing all of our behavior, except for at the teen clinic and at the 3rd Street House for our healthcare for the homeless teen team, all of our behavioral health services are being conducted over Zoom or by telephone. And we're waiting for the Cal OSHA recommendations to come through before we talk about a timeline for when we're going to return to in-person visits, because those recommendations will help guide us. And 2 more things to tag off of what Christy was saying about the Guerneville schools. We are including ourselves in conversations to make sure that we can supplement what West County Community Services has been able to provide in terms of mental health services for the students and families at the Guerneville school. And someone asked a question about the medical and behavioral health care at the Alliance in the Redwood Alliance, and a company called DEMA has been providing the medical care for all of the non-congregate shelter sites, including that site. And our healthcare for the homeless team, as well as Santa Rosa Community Health's team, has been going on site to all of the places within the county, depending on who has patients located there. And the ones out here at the Redwood Alliance happened to be primarily Santa Rosa patients. Even though they were located out here, there were a few West County patients at different times. But the folks, as they moved around, DEMA, this other agency, has been has integrated themselves in all of the non-congregate shelter sites, so was able to follow the care of all of those people. And the whole person care team through the county has also been visiting those sites as well. And thank you. Thank you for allowing me the time to speak and give all of those updates.
Well, thank you for, offering that, and very, very happy to hear from you. I have one other thing that I'm aware of living out here. Oh, I did have a question for you. Oh, I'm so bad with names, but you just spoke. Leanne?
Linnea.
Linnea, I was close. Yeah. So do you also reach out at all to Monterey School or Forestville? I mean, they're the other two larger schools in the area.
The teen clinic has been more in contact with those schools. The answer for, I don't know why, I guess, actually, the focus on the Guerneville school has been really high because of a lot of local circumstances. There's been a variety of local tragedies over the past 2 years that really brought in a lot of focus, from both West County Community Services and ourselves. I would like to have a more articulate answer for you the next time I speak.
Yeah, because I know that those two schools are, Forestville is it's a whole different community that used to be served with the teen clinic. But there is the younger population, and Monterey is also, it's a similar community, just smaller than Guerneville. I want to mention one thing that I wasn't able to get somebody to come and speak to, but I think one of the interesting things that's happening out here, and it's also happening throughout the watershed, but Clean River Alliance, in conjunction with Russian River Keeper, has an outreach to homeless. I think they're calling it Clean Camp, where they bring trash bags to homeless camps and make contact with people who are living outdoors. They bring them the trash bags, and then those people have a way to get rid of their trash. They fill the trash bags up, they're bright orange bags, and then they put the bags out, and they're picked up by the people with Clean River Alliance. And that, I think, correct me if I'm wrong, Christy and Linnea, but that has, I think, increased the outreach to the homeless in this area, and possibly increased their, their willingness to work with, people in some authority. So do either of you have a comment on that program? The outreach to the homeless that way?
This is Linnea. I will comment that that we've noticed that the services provided, the services you're mentioning, have improved the health of the physical environment of where folks have been living along the river. and has helped to educate the larger public on how providing services where people are located can make a big impact to the larger community's health. That's something that I've noticed from my perspective.
Thank you. It just seems like it's something a little different. Bob Hale.
Yeah, in the literature and in reports, there's big concern about increase in suicide rates among various populations. Have you found your suicide prevention programs stressed or able to deal with some of these issues?
Yes, this is Linnea. It's, I think, always stressed. As an agency, we've decided that we would, we support a 0% rate of folks completing suicide, and are in a continuous journey to make that be true. And so we have certainly experienced some losses of patients who have completed suicide this past year. We are in the process of actually implementing additional workflows around engaging our patients in conversations about depression and thoughts about self-harm, all the way to the more extreme planning around ending their own lives. And we expect that to make a large difference in terms of engagement in treatment for those who are suffering to that extreme. We are currently asking important questions, but we're going to be doing more. And we're actually facilitating some of those trainings in the next week. So it's a very timely question.
Have you been able to increase interaction with primary care physicians who often see the patients first and prescribe most of the medications, to educate them better about recognizing risk factors or signs of depression, anxiety, or suicide risk?
Yes. In fact, it's the primary care visit where the majority of these questions and screenings will occur. And behavioral health intervention will be a supplement to that. So where we're training the medical provider and their support team to do the initial behavioral health work. And then when it's recognized that additional behavioral health intervention is helpful, then like a therapy session, for example, or a crisis intervention, for example, can be provided by a behavioral health professional.
That's great.
Yeah.
Okay, any other questions for Linnea? Thank you both, Christy and Linnea, for your presentations. Really appreciated.
Yeah, thank you. And thank you, Christy.
Yes, thank you. Thank you all.
Okay. So Bill was not able to be here tonight. So I'm thinking that there may be a report. Sid, do you have anything to say?
I do not, but I just thought that someone should be here, so I decided to show up.
Thank you very much for doing that.
If anyone has any questions, I can try to answer them.
Okay, well, does anybody have any questions that Sid can try to answer? Or are we going to let her or are we just going to be happy that she's here?
It's so tempting to stump the stars, but I can't think of any questions. Oh.
So what's the status of the new jail programs? Is that proceeding all right or consistent with their timelines?
So the jail program's run by WellPath.
Yes.
That, they've had some turnover in personnel there. And so I'm not, I would have to ask them that. I know that everyone's just kind of getting their footing. At least that's been my take on it.
Okay.
Okay. So, oh, Bob Cobb has his hand up. Uh-oh.
Sid, could you kind of recap? I know Bill in the last month or two had been talking about things shifting around. I know that you had been doing 95% of the whole behavioral department all by yourself. And I'm just wondering how that's sifting out and who's been put in some of the roles that you've been doing recently.
That's a little bit of an exaggeration. But, so I was overseeing the adult and the acute and forensic sections for the last 3 years. And so now those have been split apart again. Wendy Wheelwright will be taking on the adult section, and I will move back to just acute and forensic. And so, but she's right now very tied up with the vaccination effort. So for right now, things are sort of status quo. Karen Salidi is the new section manager for youth and family. Chris Amarant is still, Chris Marlowe is still the section manager for the quality assurance and performance improvement section. And Diane Madrigal, who was the substance use disorder section manager, retired last month. So we are currently looking for somebody to replace her. And there will be some shifting of programs, but we haven't really landed on all of those yet. We haven't finalized what the organizational chart is going to look like. I do know I'm looking forward to having more section managers to run our programs. So.
One final piece. What's going on at CSU?
So what's going on at CSU? Yes, we have a new client care manager there. She started at the end of April. As some of you know, I was covering that role from December until she came on board. So we are still hiring staff. We had a lot of staff resign or move to other programs. We're still getting to that goal of having it be 16 beds. And because of the changes in staffing, haven't been able to do that yet, but we're currently in the process of hiring behavioral health clinicians and RNs and some extra help staff as well. So we're feeling optimistic about that. And then the psychiatric health facility, the new date we've heard that we shouldn't, nothing set in stone, but we've heard that the opening will be in November. And at that point, that should really dramatically change what things look like in terms of how long people stay in the CSU and being able to get more people to the appropriate level of care more quickly. So that's another thing to look forward to.
Thank you. Thanks.
Yeah, sure.
Else for Sid. Thank you, Sid, for being willing to answer those questions.
I guess I can also say, since we're talking about things in West County, we also are waiting for the Cal OSHA results, and then we'll be hearing more about when we can open things up more for client services. Right now, we're maintaining the same COVID procedures that we've had all along, for the last 15 months. But we are providing services in the West County. We have a case manager out there. We're looking to hire a behavioral health clinician to work out there as well. And we have a nurse running around providing services too. So so the office isn't open the way it usually is, but our staff are out there providing services.
Bob.
You reminded me of one more thing. There previously had been an office with a small amount of services out of Cloverdale, and I think that had been scaled back due to budget issues. What's happened to that facility in the last 12 to 18 months?
It's still there as well. We usually run a clinic out of there 3 times a month. Because of COVID, those have been remote. But we still, have the psychiatrist who sees the folks up there. The behavioral health clinician we're in the process of hiring will take on that caseload. Right now, it's the caseload is sort of divided up amongst other staff that work for the community mental health centers. And the nurse is still providing the services to those folks as well.
Thank you.
Mhm.
Okay. Thank you, Sid. Okay, so I'm gonna step back to the very beginning and look at approving minutes since we have a quorum, and then we'll go on with the rest of the agenda. So, do I have a motion to approve the minutes for what was that? For May 18th?
So moved.
Okay, a second.
Mary Ann beat me this time.
A first for me.
I have one thing that I would like to, I think is a correction in them, and maybe this is in the behavioral director's part. So maybe, maybe Sid, you know enough about this to see if my correction is right. But one of the bullets says the MHS OAC oversees the innovation funding of MHSA. A little over a year ago, Behavioral Health identified project, and MHSA has been very slow to respond. Should that say MHS OAC?
Boy, it sure sounds like it, but I can't say for sure. That it sounds like that is correct.
Yeah, because I think that it's the oversight committee is the one that
It's slow to respond. Yeah. But I don't know for sure. That's Bill and Melissa Ladresh would know the answer to that.
Okay, so can we approve them with that question?
I think we can approve them with that question. We can
Okay.
just put it in the minutes for this time that we want a clarification on the name of that agency.
Okay. So all in favor of approving the minutes with that clarification question?
I have a question.
Yes, the question, Bob?
How will that be followed up between now and the next time we're all together? Is someone to be assigned to that particular question or what?
That's a good question.
Kathy, I can follow up with Bill and clarify it and then resend out the minutes to everyone with the update.
Okay. Does that sound acceptable? Okay, so we can vote for the minutes with that one question being clarified, and you'll report back to us on that at the next meeting. Okay, so all in favor of approving the May 18th minutes with that clarifying question? Give me a thumbs up if. Okay, so all present. Vanessa, I can't see you, so. Okay, she's saying yes, okay. Okay. So that is passed, and then the retreat minutes we haven't approved yet either, I don't believe. So do we have a motion to approve the retreat minutes? Bob Hale, you were first. Do we have a second for approving the retreat minutes? Okay, Vanessa's got her hand up. And I'm thinking that that's what your hand is up for, Vanessa, so.
Yes.
Okay, perfect. I do have one correction on those. In item number, okay, I have two corrections. The title says Mental Health Board Retreat Agenda, and it needs to be changed to minutes. And in number 2, it says Kathy agreed to this year's annual report. Kathy agreed to write this year's annual report. Okay, so add those, change agenda to minutes and add the word write. Okay, so any other questions or comments on those or discussion? Okay, so all in favor of approving the retreat minutes with those 2 corrections? Thumbs up. Okay, Peterson and Peter.
I would like to abstain from both approval, both the 18th and the
Yes.
retreat.
I forgot to ask for abstentions in the last one.
Yeah.
Peter?
I'm abstaining from the retreat minutes. I was not present.
Okay.
I was present, but I am abstaining.
Okay. I should have asked for anybody who did not want to approve the minutes on the first one, but the second one, anybody opposed to approving the minutes? Okay, that was a little out of order, but I think we got it. Okay, so other reports. Bob Hale, did you have anything to report on your?
Yes, we this week interviewed a consumer from both Progress Foundation and Buckaloo, and we completed both reports, and Tori has them, and she'll be sending them out to the Mental Health Board. But I was very impressed with the quality of care, the dedication of the individual, and the positive response of the consumers that did one via Zoom, another he sent his responses in, and we talked on the phone. But I think they were very impressive, both programs that we visited. There's no real serious issues and just minor things here and there, but you'll get a copy of the reports probably by the end of the week. And then Bob Cobb and I are going to be doing Brown Street and Hope House next Thursday. That'll be the next in the category. And then I got emails out to Access, Whole Person Care, Older Adult Collaborative, and Mobile Support Team to see if they would have an hour of their time so we could go over their programs. So.
Okay. Excuse me. Anything on jail mental health services? Has there been any movement there?
No, it's been all quiet for the sheriff.
And QIC is on here as well. And they have been working on putting together the PIP, which is the Program Improvement Project. Did I get that right? Anyway, the
Performance Improvement Project.
Performance Improvement Project. Thank you. I'm so bad with these acronyms. So they're working on the 2 that they're going to be working on for this year, and actually have some data that is that they've been putting together so that they have a good baseline and some information on last year's. And all of that information is available online. And you can also look at the EQRO, the External Quality Review Organization website for it as well. But related to that, we had decided that we were going to have our meeting on July 13th, and we were planning on having the MHSA annual hearing on that date. And there wasn't enough time to get ready for that hearing. So Melissa has requested to present later. And so she is going to do that large meeting in September, which is the next time that we have a meeting on our regular date. We'll keep the July 13th meeting, but Wendy Wheelwright and Erica Chloe have been running the QIC meetings, and they're going to present on July 13th and tell the board more about QIC, what it's been doing, what its purpose is, and more about it. So we'll still have our meeting on July 13th, but you'll hear a lot more about QIC on that day. And Peterson's going to be running that meeting because I still can't be there. So help him out and be nice to him. Okay, so.
Kathy, excuse me.
Yes.
Mary Frances would like to comment.
Sure.
Hi, I just wanted to add about the jail group. I just wanted to make sure that each of you had received the letter from the project manager. It had been sent to Tori, I think. It was an update. So did each of you see that? So you're aware of the latest plans on the building, putting it out to bid, and the fact that they predict that it will open in 2024, talking about the new behavioral health unit at the jail. Is everybody familiar with that? Yeah.
I do remember seeing that letter.
Okay, thanks. Sorry, that's all I wanted to add. And I just wanted to say that in terms of programming, I know that they're still not entirely open for visitors. So it's very limited visitation, and that means very limited ability of outside groups who normally would come in and provide some kind of programming in groups. So that's all I wanted to add. Thank you.
Okay, and hopefully they will be opening that up soon.
Yeah.
Yeah, it'd be interesting to know if that population has been receiving vaccinations. But that's just another topic. Okay, so we have 3 vacancies still, 1 in District 2, 1 in District 4, and 1 in District 5. So there's that. And oh, it's in red, so I couldn't see it. Board votes on chair and vice chair nominations. I skipped right over it because it was flashing at me. So Bob Hale and Bob Cobb, you may take over and conduct that vote. One of you can take over.
Go ahead, Bob.
We have the slate that has been put forth and we're grateful that the existing officers have agreed to extend their term an additional year, such that we're putting forth nominating Kathy Smith for chair for this coming fiscal year, and Peterson Pierre for vice chair. We are also, the floor is open if there are any who would like to be additional nominations to be received before we have a vote this evening. And Tori, if you spot anyone.
I don't see any hands.
Okay, well, why don't you Bob, why don't you actually conduct the vote for each of the two?
So why don't we start with Vice Chair Peterson? I move that he be appointed Vice Chair, and he's recommended by the committee, which was Bob and I. So all those in favor signify, or do we do the actual vote?
Do this.
Okay. Anyone opposed? See none. Congratulations, Peterson. And want to recommend Kathy Smith for a third year, which is, and especially she has so many other things going on. I'm very grateful for her to continue a third year. And do I, not hearing any other recommendations, I'd like to move that Kathy be appointed to the third year as chair. All those in favor?
Aye.
Any opposed? Well, congratulations, Kathy. Appreciate your fine work this past 2 years and one more year. Looking forward to it.
One more year, that's it.
That is, yes.
And now you guys earn the big bucks.
Bob and I promise we won't ask you again.
Okay.
And Tori has agreed to serve another additional year as her staff support.
You talked to my boss on that one. I'm kidding. I'm kidding.
So I did ask, so Peterson and I had a conversation about QIC, because at one point we had, that had been one of the things that we were going to have the vice chair do. And he has a committee meeting that's at the same time as the QIC meeting that he has to be at. So as you are listening to the QIC presentation next month, be thinking about, whether you'd be interested in being assigned to that committee. And so that's just something that you can be thinking about. Okay. I don't think that I have anything further. Does anybody have anything that they would like to discuss beyond what we have done? Okay, I will entertain a motion to adjourn.
So moved.
I think she beat you again, Bob Hale. Do you want to second it?
Second it.
Okay. Okay, so the meeting is adjourned.
Thank you.
Nicely done, Kathy. Thank you.
Thanks, Kathy.